Welcome to Shining a Light on Canada's multi-layered approach to FASD prevention. My name is Linda DeChef, and I'll be your chair for this evening's session. The session will highlight some of the impressive work happening across the country in FASD prevention across multiple levels. We've divided the session into 4 different layers. In terms of the kind of work the presenters do in government and policy development, research, service provision, and community advocacy. What you may notice, however, during the course of the presentations tonight is that almost all of our speakers bridge those layers, either in the work they themselves do or the working relationships they have with people in the other layers. Many of those relationships have come about as a result of the network action team that we all belong to, as do several of our audience members this evening. And Nancy Poole is going to tell you more about the NAT, as we call it, in her introduction. Nancy is the Director of Research and Knowledge Translation for the BC Centre of Excellence for Women's Health, the Provincial Research Consultant on Women and Substance Use Issues for BC Women's Hospital, and the lead for the Network Action Team on FASD Prevention for the CanFast Research Network. Nancy is well known for her collaborative work on FASD prevention, research, training, and policy initiatives with governments and organizations on local, provincial, national, and international levels. Nancy.
Well, welcome everybody. This is so great to have this chance to profile the work that we're doing in the context of this network action team and also in Canada in general. I wanted to start by just saying a few words about the NAT, as we call it, which stands for the Network Action Team on FAS Prevention from a Women's Health Determinants Perspective. So now you know why we call it the NAT. And this was from an annual report we did in 2010 and 11, this picture here, but I thought I'd put it up because it gives a little bit of a sense that at that time we were 43 members from 28 organizations, and we had 10 peer-reviewed papers that year, 7 book chapters, 1 face-to-face meeting, 3 research projects completed, 2 new research projects funded, 11 virtual meetings, etc. It gives you a sense of kind of the energy of the network action team, plus the great layout that Tasman does for us on lots of our publications. But those kinds of things on here are things that often we're asked to tell to the Canada FAS research network overall, the kinds of things that researchers are asked to put down that they do in a year. What were your research projects funded? What were your conference presentations? What were your peer-reviewed papers, etc.? And I think tonight you're going to get such a nice sense of how much more we are than just those wonderful things that we achieve from the research frame, but you're really going to be able to see us from lots of different dimensions. So the second thing I just wanted to say is to kind of put this slide up to give a sense a little bit of the importance of this issue. And I feel like this is a piece of research that I had the opportunity to do this year with Dr. Gerald Thomas from the Canadian Centre on Substance Abuse that kind of gives a sense of how important it is that we be doing this work, given how common drinking is amongst Canadian women of childbearing years, and how much we have to do to bring about a shift in this so that we can prevent fetal alcohol spectrum disorder. So tonight we're going to be all about this multi-level approach to FAS prevention. And this is something we've been thinking about and working on for a number of years, this idea that we need to be thinking about in our prevention of FAS about broad awareness building and health promotion efforts. We need to be thinking about discussion of alcohol use and related risks with women of childbearing years and their support networks. We need to be thinking about specialized holistic support of pregnant women with alcohol and other health and social problems. And we need to be thinking about the women postpartum as well, the new mothers and their children and their needs at that point. And all of this has to be linked to supportive alcohol policies, supportive child welfare policies, supportive policy that helps prevent violence against women, etc. So that's the story that you're going to hear tonight, is how we're trying to really link these types of FAS prevention and think about not privileging any one of them over the other, but really thinking about how do they fit together and how can we strengthen the work that we're doing on all of them. This year, in some of the work we've been doing in our NAT, we've actually been starting to do some work around the level 1 piece, and we've had the chance to work with the British Columbia government on writing content for educational pamphlets that are in all the liquor stores. We've worked with the Girls Action Foundation to support their girls group facilitators on beginning to do community-based work with girls. And you're going to hear lots about what's being done in Saskatchewan around campaign-level work. In the level 2 area, we've had a chance to work with the folks at Memorial University about building training for all the people involved in medical schools of Canada. We've also had the chance to think about online brief intervention training with the Canadian family physicians and helped them with their guidelines for working. And we've made many, many presentations for social workers, nurses, anti-violence workers, etc. In the level 3 area, we've had a chance to work with, for example, Her Way Home in Victoria to support the development of their one-stop programming. And we've also been really able, and you'll hear lots more about this tonight and tomorrow, we've also been able to work with women in the North around defining what they see as helpful in FAS prevention. And we've had a chance to pull together people to describe what the one-stop shop work looks like in our work with high-risk women at the community level. So lots of work in level 3 this year. In level 4, we have lots more to do, I feel. In the course of our FASD evaluation project that you'll hear about tonight, we've had the chance to work with Kermode Friendship Center on a tailored, principle-based approach to evaluation of mentoring programs. But I feel like the level 4 area is a piece that we've got lots more to do on. So that's my story tonight about where we are as a NAT, and I hope that you really enjoy this evening as you hear about what people are doing and what they're seeing as really important pieces of this work to prevent FAS.